Did you know that a simple blood test is a window into managing better bone health? Hi, my name is Wendy Murphy, and this is episode 3 of the Bare Bones podcast, Blood Tests, a Window into You, where we'll talk about the importance of blood test screening. Joining me is my colleague, Anita Kaiser, who has over 25 years of experience living with a spinal cord injury. And our guests, Dr. Leslie Morse, Department Head and Professor of the Department of Rehabilitation Medicine at the University of Minnesota Medical School, and Co-Program Director of the Minnesota Regional Spinal Cord Injury Model System Center, and Dr. Kathy Craven, a Senior Scientist at the Kite Research Institute and Medical Director of the Spinal Cord Rehab Program at the University Health Network, and a Professor at the University of Toronto. I'd like to welcome you both to the show, Dr. Morse and Dr. Craven.
Thanks for having us.
Happy to be here.
I'll begin with you, Dr. Morse. Can you talk a bit about blood testing and its overall importance for people with spinal cord injury?
Yes, thank you, Wendy. When we think about blood testing, it's most helpful when identifying and ruling out secondary causes of osteoporosis. And by that, I mean other medical conditions that can exacerbate or make worse bone loss after spinal cord injury, in addition to the spinal cord injury. So we often think about thyroid function, renal function, the presence of diabetes, anemia, liver function, and the big cause of secondary osteoporosis, which is vitamin D deficiency with associated hyperparathyroidism. So for identifying and potentially treating these causes of secondary osteoporosis, lab work is very helpful in that situation.
Thanks for highlighting this very important information, Dr. Morse. So now, do these tests differ for men and women?
Yes, Anita, thank you. That's a very good point. Hormonal status is also another important consideration, and lab work can help us in that domain as well. So there are recommendations for premenopausal adult women and adult men that are the same. We recommend testing follicle-stimulating hormone and luteinizing hormone for both men and women, and then morning fasting serum bioavailable testosterone for men and prolactin and estradiol for women.
Thanks for explaining those differences. Now, if a person has already been diagnosed with osteoporosis, are there any blood or urine tests that are important for them to get done before they start any form of treatment?
Yes, there are a couple of considerations when starting medications for osteoporosis. The first being vitamin D deficiency. And so it's really important, regardless of the drug that we're using, that vitamin D deficiency be identified and treated before initiating therapy, because particularly the anti-resorptive medications like bisphosphonates, when using a bisphosphonate in the context of vitamin D deficiency, it can cause osteomalacia, which is a painful skeletal condition. And so we really want to avoid that. There are some other considerations also with calcium homeostasis. So it's really important to monitor calcium levels. Some of the injectable medications, such as Evenity, Prolia, and the PTH analogs, such as teriparatide or abaloparatide, can cause either high or low calcium levels. And so we would want to monitor those. And then bisphosphonates can also impact renal function. And so we would want to check renal function before starting a bisphosphonate to make sure that we're not causing additional worsening of kidney function.
Now to you, Dr. Craven, let's take this a step further. Are there perhaps additional tests recommended, let's say aging or following a fracture?
Great question, Wendy. There are a few. So I wanted to start by asking the question about changes with aging. Most people, as they age, develop more health conditions. So as a person is aging, it's very important that their vitamin D level be checked if they have any change in the number or type of medications, as certainly changes in medication can affect vitamin D metabolism. So as one's aging, that's an important piece. And the other thing is that if a person presents with a vertebral fracture, which is less common after spinal cord injury, over the age of 50, that should prompt some additional testing, particularly screening for multiple myeloma, as well as for a number of cancers that can spread to bone. So breast cancer, particularly in women, but also thyroid, kidney, and prostate cancer. And when a person has a fracture, as we talked about in the very beginning episode of this podcast series, there's a paradigm that we would like clinicians to follow. So we would ask that after a fracture that the treatment team revisit the severity of a person's osteoporosis, their fracture risk, and to make sure that they are on the appropriate treatment.
Thanks, Dr. Craven, for highlighting these considerations and issues we need to think about when aging and when following a fracture. So when we visit our family doctor, that's usually our way of learning how to maintain our health, including our bone health. And so I'll ask both of you, at what point should we consider turning to a specialist in bone health for more specific care? And I'll start with you, Dr. Morse.
Yeah, that's a great question. So as we know, osteoporosis that occurs after spinal cord injury has some distinct features compared to age-related or postmenopausal osteoporosis. So I think it's really important to address bone health with a provider, whether it be your primary care provider or a spinal cord injury specialist or another provider who has a lot of experience in expertise in dealing particularly with disuse osteoporosis.
Thank you. And what are your thoughts, Dr. Craven?
I agree with Dr. Morse that specialist care is needed for patients with spinal cord injury and low bone mass or osteoporosis, and definitely for someone with a prior fracture. However, your family physician can help you in ensuring that your bone density testing is done at appropriate intervals and assist by ordering the test and then reaching out for specialist help in deciding what's the appropriate management, particularly if someone has had a decline in bone density or a recent fracture.
Thank you both for this great information. Now, Dr. Craven, what would be your final take-home message for our listeners today?
Get a blood test to learn about your bone health.
Thank you both. If you found today's talk interesting, check out our action planning tool on the website at www.scifragments.ca and feel free to send us your feedback using the survey provided on the website. In the next episode, we'll talk about bone density scans.